All right, we can get started. So welcome everybody to day 4 of the Planetary Health Annual Meeting, co-hosted by the University of Sao Paulo and the Planetary Health Alliance. My name is Max Zimberg. I'm the Community Building and Outreach Coordinator at the Planetary Health Alliance, known as the PHA, based at Harvard University in Boston, Massachusetts. I am humbled and honored to be introducing a discussion between 3 of my favorite people in the global planetary health movement. This is the annual meeting's 4th interview entitled Leadership and Planetary Health Lens in Governance and Policy, following the day's focus on governance, diplomacy grounded in planetary health science, stories, and solutions. So I will briefly introduce our moderator, Dr. Teddie Potter, who I will turn it over to for further introductions and to lead us through the discussion. To our audience, thank you for being here, and remember that you can write your questions using the Q&A chat in the bottom of your screen, and we'll do our best to answer them live. And thanks as well to anyone watching via the recording and sharing that. So a few words now to introduce and capture the magnificence that is Teddie Potter. Dr. Potter is a clinical professor and director of planetary health at the University of Minnesota School of Nursing. She is specialty coordinator of the Doctor of Nursing Practice in Health Innovation and Leadership, executive editor of the Interdisciplinary Journal of Partnership Studies, along with Dr. Rianne Eisler, who many of you met yesterday in an exciting interview. Her direct engagement with the PHA runs deep, including serving as chair of the Clinicians for Planetary Health, or C4PH initiative, co-editor of the recently published Planetary Health Education Framework, and an important member of our steering committee. Dr. Potter is committed to climate change education, including co-founding Health Professionals for a Healthy Environment, membership in the Alliance of Nurses for the Healthy Environment, chair of the American Academy of Nursing Environment and Public Health Expert Panel. She's also a member of the Coordinating Committee on Columbia University's Global Consortium on Climate, Health, and Environment Education, a fellow at the Institute of the Environment at Minnesota, and co-creator of Nurses Drawdown. And last but certainly not least, Teddie is one of my dearest mentors, friends, and along with Courtney, a sister in radical systems change. So welcome, Teddie, and over to you all. Thanks for being here.
Thank you so much, Max. What I'd like to add to that wonderful introduction, and it's much appreciated, is that my name, that I stand on the land of the Dakota and Ojibwe people, who are the original planetary health experts of Minnesota. I also want to invite all of you into this discussion today, and so please feel free to use the Q&A feature at the bottom of your screen. Before we begin, I want to extend my personal gratitude to Dr. Antonio Sareva and his team at the University of Sao Paulo, and to the Planetary Health Alliance team, who've managed to plan and execute a complex and meaningful international conference during a global pandemic. Their leadership exemplifies the partnership and humility so desperately needed today. In 2018, Sarah Stone, Sam Myers, and Christopher Golden published Cross-Cutting Principles for Planetary Health Education. One of the 12 essential principles of planetary health is governance. They write, leadership is the ability to turn capacity into action and generate the capacity when it does not exist. Today, it is my honor to interview 2 planetary health leaders who exemplify this principle, turning planetary capacity into action. I'd like to introduce our panelists. Dr. Courtney Howard is an emergency physician and former president of the Canadian Association of Physicians for the Environment, or CAPE. Dr. Howard sits on the board of the Canadian Medical Association, the editorial advisory board of the Planetary Health, of Lancet Planetary Health, and the steering committee of the Planetary Health Alliance. Dr. Sandeep Maharaj is Associate Dean of Distance Education, Planning and Projects at the University of the West Indies, and he's Director of the Entrepreneurship and Business Transformation Office for the faculty at the UWI-STA. He is Global Outreach Fellow for the Planetary Health Alliance. So I'm going to start out with this question. Very few children say, when I grow up, I want to work on policies. So can each of you share your origin story? What moment or event launched your desire to serve in public office or work on public policies? Courtney, we'll begin with you.
Sure, I'm gonna take advantage of where I'm standing right now to just turn my computer so you can see where I am. So this is Dene territory. Can you see the lake out there? So that is Great Slave Lake. We are downstream from the oil sands. And so in fact, I am an emergency doctor and I moved up here when I was pregnant with my first daughter. And we were not awesome breastfeeding partners. There was a lot of threshing and crying. And so we couldn't do anything else at the same time other than just breastfeed. And as you know, that takes about 8 hours a day. And so I spent an entire winter breastfeeding, looking out at this lake, wondering if there were health impacts from being downstream from the oil sands. This is a majority Indigenous area, Chief Dragi's territory, Dene territory, and the elders were worried. And so I thought, okay, I know, I will do a literature review. And there was nothing in the literature because we simply haven't done the research. And, you know, environmental racism is alive and well in Canada, unfortunately. And that has to do also with sometimes us not researching to figure out if communities actually, you know, what data we can produce to back up or to substantiate or reassure when people have concerns. And so I got really curious, and then I was appalled that there was no research. And I had an opportunity that summer to be a delegate to the Canadian Medical Association General Council, which as a new doctor in Canada was actually hard to get. And it was just because I live in a place very far away from sort of central Canada. There aren't a lot of doctors up here. So whereas you usually have to put your elbows up and, you know, fight through the old boys club for quite a long time in order to get to go, I was just able to go. And so I thought, okay, if I'm going to go, I should make a motion. And so my motion was to ask the Canadian Medical Association to support increased peer-reviewed studies into the local health impacts of the oil sands. And I went and I presented my motion, and it was all very parliamentarian, and I got yelled at big time because people were not ready to talk about that moment. And what that showed me was we were a place where the intersection of data and research and policy and power was not serving our communities. And I, you know, woke up the next morning, kind of like peeked up over the sheet and was like, did that really happen? And in fact, it was so inflammatory. We made cross-country headlines. And what that showed me was that work needed to be done in that area. And so since then, I've you know, worked for Lancet Countdown as a policy manager. I have produced multiple policy briefs here in Canada. And then at the onset of the pandemic, I thought to myself, this is a hinge moment in human society. And so at that moment, I decided to run for the leadership of the Green Party of Canada. I came third. It was my first time out, but it showed me what it meant to make a platform based around planetary health. And so that's entailed a lot of learning, a lot of oral exams in the form of debates, and definitely was one of the sort of highest impact learning periods of my life.
We look forward at a later time to ask you about some of the things that you learned. We'll hear Sandeep's origin story.
Well, it's actually very divergent from Courtney's. Hers started off on a research trend. And, you know, the good thing about politics, you know, politics is supposed to, at the end of the day, bring and change policy that is reflective of the people that put you there to deal with it. And there's also a major emotional end to politics as well. That is not really tangible and not research driven, but very emotive. And you asked about children. I actually got my first taste of politics at 9 years of age. There was come from a very small rural village, and there was an election campaign in 1989 where a gentleman had died. And, you know, I saw all of the politicians were fighting for that area at the point in time, and all the parties. And I just got tied into the emotion of it. However, more and more as time went along, and this is why children, you asked a very important question, why children shy away from politics. Mm-hmm. It all has to really do with our education process. In politics, as I would have started off, as I tell you, there's a level of fanaticism. Persons, there are persons who look and read and they like they like policies and they support policies, but there's still a significant, at least in where I live, and I presume it might very well be across other parts of the world, there's a significant amount of fanaticism that is involved in it. And what happens with fanaticism or persons buy into just an ideology without thinking and support blindly is that the whole process of thinking is thrown out. And the more we educate our children, they cannot live with that process of not thinking and not supporting or blindly supporting something. And hence, in my region, among children or person or young adults, I'll also add the young adults because, you know, politics is not seen as something to get involved in, because obviously I think this is a global phenomenon where politicians are thought to be corrupt or are corrupt, however, but I won't put a judgment on that. But more importantly, they don't see the ability of thought going into what is being pushed and presented. They always see persons and the politicians in my region, as far as I'm concerned, going towards the lowest common denominator, which is their base support, and persons who are run on emotive and motions. And what tends to happen, and I'll be further brief, politicians are always trying to pacify those that are emotive because of the general 5-year cycle in which we operate in our region. In the US, it's 4 years. So in the ability to get re-elected and selected, and that in terms does quite a lot of damage to countries for consistency in policy, going that make meaningful change over the long term. Sorry for taking up that time, Teddie.
No, it's a wonderful lead into our next question, because our next question is that policy changes can feel painfully slow. And we're told, and we've heard all week long, that we are in the midst of an urgent crisis. So why do you think the planetary health movement needs politics and policy changes when other possible actions are faster?
Is that for me or Courtney?
Courtney, we'll start with you again.
So I actually really appreciate the fact that I'm still an emergency doctor. So I have the opportunity to go into the emerge and make an impact on people's lives, you know, on a day-to-day basis. It's sort of a high glycemic index kind of change making that I appreciate as a counterpoint to the policy work. But we know that at the end of the day, you know, when I'm in the emerge, if somebody without a home has a foot ulcer, that won't heal if they don't have a home. And so you actually spend enough time at the bedside to realize that in order for people to be well, you need to attend to the social determinants of health, the structural determinants of health in terms of political voice, as well as the ecological determinants of health. And so really that work is almost what motivates me to go do the policy work. And because at the end of the day, you know, the rules that we make for ourselves matter. And also where we allocate our resources really matters. So I worked at many different parts of the change-making spectrum. And, you know, politics is difficult. I now view political involvement as a very important part of decolonizing planetary health, because when you think about it, if we want to set up a playing field where everybody has an equal opportunity for health, that means that high-income countries need to stop setting up the international order in a way that most benefits them. And the only way we can influence the high-income countries to do that is if we get involved in the political structures within them. We look at this vaccine problem that we're having right now, where high-income countries are arguing at the WTO not to, in terms of in favor of patent protection, instead of in favor of allowing every country to make the current vaccines to, you know, in accordance with their abilities to vaccinate their population. You know, when we set up those international structures in a way that benefits high-income countries, it has huge impacts downstream. And so I think at this moment, we have to be realistic with ourselves and recognize that, you know, each one of us in some ways lives in a developing country that is still trying to find its best self in terms of its approach to health, both for our populations and the rest of the world. And it matters how we show up in all of these fora, and it matters how we spend our common sort of pool of resources as taxpayers. You know, are we going to still fund fossil fuel subsidies? Canada has spent over $20 billion subsidizing fossil fuel companies since the beginning of the pandemic. You know, and that's in the context of a year where a big study out of Harvard showed us that 20% of premature deaths are related to fossil fuel related air pollution. And so although it's messy, although there's a huge time cost, there's a huge money cost of political involvement, it's sort of the messy thing we still need to do.
Wonderful, thank you. And Sandeep, you also mentioned that politics is oftentimes about personality, but we want to get to the deep change that Courtney is referencing. So why would you say planetary health needs to be involved in policy changes?
Yeah, so as you rightly said, it's very much about personality as well as policy. Mm-hmm. You see, when you elect someone, you have given them a right to act on your behalf. And all of the research and science is showing today that basically, again, from greenhouse gases to issues such as food sustainability, the way we eat, the way we clothe ourselves, the way we fuel ourselves, at the end of the day, the enormous problems that are caused by that can all be solved with planetary health solutions. And hence, those people that we entrust and we give that authority to are definitely given even a greater impetus to look at planetary health in a real way that they can implement those policies within their country to be a better mankind. Now, in politics, when you give authority for a person to make policies, it's not for you. It is for you and future generations to come to ensure sustainability happens within that jurisdiction which you are in. And today, the mechanism that seems to be most accepted is that of democracy, or pseudo-democracy, as one may call it. And as we give that authority, I mean, it basically comes down, do you want to leave a bad future for the generations to come? And planetary health solutions, as you have put out, built on research, education and engagement of community, and so on, is really a great solution. Would planetary health need to be on a political agenda 10 years from now? I hope not. It should be something as seeing the political agenda, because really and truly the political agenda is actually pushed by the problems of the day. And I really hope this is no longer a problem in 10 years from now. We shouldn't be having these conversations. So at the moment, the problem of the day can definitely be solved with a number of the solutions that planetary health put forward. And hence, that's why our leaders should be taking it up at the front of their agenda.
Absolutely. And if we are really going to be behind a great transition where everything has to change, we need planetary health informed people at the table, making the laws that are going to guide this great transition. So oftentimes, as you know, we don't have the luxury of time to sit down and give someone a PowerPoint lecture about the fine details of planetary health. We sometimes actually do have an elevator period of time between floors to tell that person why planetary health is important. So I am inviting each of you to tell me what your elevator pitch is to people who've never heard about planetary health. How do you summarize it succinctly and get them excited to be involved in this? So Sandeep, I know you're so excited about planetary health. Maybe you already have a pitch in your back pocket.
No, I think the key is basically in planetary health, if I have to pitch to anyone, the very first thing that we show is the impact and devastation within my region, the Caribbean region, the hurricanes have had within the last 2 to 3 years. And let them know the economic cost of that. It costs approximately over 200 million US to reconstruct some of these economies, and over 1 billion to basically when you look at the region overall. And the potential impact on morbidity and mortality, because normally we talk about the deaths, we don't talk about the depression, we don't talk about the issues that long-term effects, mental health effects it has on persons. We don't talk about the issues of heat strokes and so on. Those things are very much covered. So generally, my pitch is what they can see tangibly, which is the storms, the hurricanes, and then that acts as a segue to get in other issues into there, which are morbidity and mortality related at the end of in my part of the world.
And you just applied a couple key principles of climate or planetary communication, and that is keep the story local and relatable to the people you're talking to, things that are happening in their area, and also link it to health and the health impacts of what's happening. Those are two key strategies. So speaking of health, Courtney, what is your pitch? If someone has not heard of planetary health, how do you introduce it in a short period of time?
Yeah, that's a great question, because you only usually get, even around a board table, maybe 2 minutes, and it can be challenging. So I would do exactly as you've recommended, you know, tying it to something. Right now, it's easiest to tie it to the coronavirus crisis. So we can say something like, you know, the coronavirus crisis has shown us that when pressed, we prioritize health. And now we understand so much better what that means. And when we look at what began this pandemic, it started with a virus that originated at the intersection of humanity and the rest of the natural world. And what we know is that if our world continues to change, we're going to see future habitat change that is going to put humans and vectors and animals into new proximity and lead to future zoonotic spillover events. So because of that, as well as because of the underlying threat of climate change, which in my area led to, in fact, a summer of smoke with 2.5 months of smoke that led to 2 times as many as our normal amount of asthma visits to the emergency department, we can see that we need to pay deep attention to that intersection of health and the rest of the natural world. So when I think of planetary health, I think about the ecological foundation, climate, soil, water, that in fact is necessary for us to be able to build stable social and economic systems that then give rise to the social determinants of health, things like housing and income. And all of that is required for us to be able to staff and supply the very complex structures that are our healthcare systems, where I work and where I'm very proud to work. But increasingly, we're realizing that in order to be able to provide healthcare, we need all of those layers underneath to be stable. And it's right now where we're in the window where we need to take very effective action through policy, through appropriate allocation of resources to stabilize those ecological foundations.
There you heard it, folks. 2 wonderful pitches, planetary health pitches. So start working on yours, because they can be powerful, even though you have 2 minutes that you're allotted. So I'm going to pivot a little bit of now that we have planetary health experts in our midst. Let's talk a little bit about how you have been involved in politics. So Sandeep, there's sometimes a debate about whether elected officials accomplish more locally or nationally. What are your thoughts on that?
Well, again, it arises out of basically persons making a decision. Most of our issues, when you come from small island states like us, it's very, very low. National issues impact locally. So at the end of the day, our politicians are expected to think both in a local and national context. To ensure, and in fact, their scope generally has to go to a regional context, because things such as trade agreements, all of these issues impact us as one block. Simple example, recently there was an eruption of a volcano, and a significant amount of ash fell on another island right next door, which had nothing to do with it. So in my context, our politicians really need to have a local, national, regional outlook at all points of time due to size. It's really constricted by size and how each other impact. Now, from a planetary health point of view, it is even more important that we look geographically, regionally, because things such as scale, food, where food is produced, maybe on another area we get our major food supplies. One island may not be sustainable for its own food supply and so on. And hence, when we do that overlook, and if you really want to get a planetary health lens running in this region, persons have to think beyond the national and regional in our perspective.
So a little of both is basically the answer to that question.
And even further out. a little boat, even further out.
Yes, and dream big, because we want Planetary Health members of our community sprinkled all over the place. The United Nations, World Health Organization, and various national governments, all the way to your municipalities that you live in. So Courtney, you actually ran for office. Can you share with us some of the lessons you learned from that experience?
Sure. So it was very interesting. It was just about a year ago now. So the pandemic had started. Here where I live, we've been super lucky. We have a very effective partnership between our female premier and our medical officer of health. So we were able to stop, basically, we isolated ourselves kind of like New Zealand of the North, and have been COVID zero for most of the pandemic. So despite the fact that I'm a frontline worker, I wasn't called upon to really manage the pandemic. But I was very, very conscious that this needs to be a hinge moment, really the beginning of a great transition. And it was right then that the leadership for the Green Party of Canada was begun. And so I waited to make sure that, you know, COVID wasn't coming back. And so I entered right at the very last minute. And then what was interesting about that was you were called upon to create a platform. And so I thought to myself, okay, well, what we want right now is health. What everybody can agree on is we want a healthy now and a healthy future. And so I positioned that as what I called my North Star in my platform, was a well-being society. And then when you do that, in fact, a platform creation becomes very easy, because you just do a lit review and you're like, okay, well, what adds up to health? And then you think, okay, well, inequality, bad for health, less inequality. What are the appropriate, you know, things to do in Canada to decrease inequality? Oh, somebody proposed a wealth tax. That looks good. How much is that going to cost? Let's have a wealth tax. And so, in fact, a lot of work had been done by the Parliamentary Budget Officer to cost out various different initiatives proposed during a previous federal election. So I went through those sort of in cross-reference with my lit review, decided what we needed, and then looked to see how we could best communicate it. So we ended up with several different products for different sort of levels of engagement. So there was a 70-page platform, and I was very lucky to have it sort of blindly peer reviewed by some of the people who are listening here, international colleagues who really generously, at one point, there must have been 10 scholars from around the world, sort of all in the same Google document, editing different parts of it right before, because it's all done on a really tight timeline. And then we created sort of 9 policy planks with a video for each one and a short. And so really for me, it was as much graphic design and communication as the actual scholarly nature of it. But it showed me it's very possible to create a evidence-based platform, and people liked it. We actually, our sort of numbers were going like this through the campaign. And had I started earlier, many people think I would have won. But what I learned through that process is that really the bottom line is your metrics as a politician are still fundraising and votes. So you have to be thinking about the policy, but also very much still getting on the phone with donors, still trying to make sure you have the organizational machine around you to get the vote out. So I learned a lot that I'll be able to apply next time. But really, we need to, in some ways, be kind to politicians and make sure that we're aligning what we do with their metrics. Because if we're not speaking to their need to get more money and more votes, we're not going to be able to help them get into office in order to enact the policies that we'd like to see.
That's a great segue into a question that was asked by one of our attendees. And I think it's a wonderful question. It's about strategy. And it says, some people think that it is strategically wise to take an anthropocentric approach to policy change because people in power tend to be egocentric versus ecocentric, and they make decisions that will get them reelected in the short term. What are your thoughts about the strategy of our discourse? Sandeep, I'll start with you.
Yeah, so I think he has hit it right, he or she hit it right on the nail on the head, that, you know, it's really working on their egos to get that information into politicians and let them know. I think Courtney has said work with their metrics, which is a very good mechanism to deal with it. However, what is also critical and what we should not underplay is education, education, education. If we need, because the politicians will also, their metric will also go towards the vote. And if we are able to educate the population, educate our professionals, our trusted workers at the end of the day, and the future generation that is coming up, their policies will naturally go that way, because that's the way they will get the vote. Because people will understand really and truly that there is a problem, and these are the means to fix it, and will push them to make that policy. And also, it will throw up a few leaders out of there who will get involved in politics that are educated about the issue going forward. So my answer to that is just educate as far as possible.
Thank you so much. Courtney, a question from the audience for you. Global warming and other global environmental problems have been known for decades. Is there still a need to raise the awareness of politicians? And what's the difference between planetary health approach and other approaches? In other words, we haven't had a lot of movement going. What does planetary health bring to the discourse?
I think this has to do, in fact, with the previous question as well. And so when I think about this, I actually take what I've learned as a clinician and apply it in these spaces. So when I'm a clinician, I try to be patient-centered in my approach. So wherever I am, whatever's happened to me in my life, I walk into that room and I am patient-centered. I am attentive to that person, where they are in this moment, what their background is, what their point of view is. I ask enough questions to figure out where they're coming from. And then I tailor my message based on what I think will most speak to them. And when we do all this work, we need to be audience centered. So I think that sometimes we're so distressed by the situation, whether it's eco-anxiety or ecological grief or just that real sense of urgency, that we can end up in front of a policymaker and essentially not be as audience centered as we need to be in order to speak to them. It's important I've always found that action feels better than anxiety, but it's very important that we not act out of anxiety, because at that point, we're no longer centered, we're no longer strategic, and we're no longer open to that feedback we're getting from the person we're speaking with. And so I will tend to see where people are at. And then if I can see that they're in a very egocentric frame, I will sort of gently nudge them this way. If I can see that they're already egocentric, I live in an Indigenous community, and so often people are, then we can just sort of start there. But really important to sound out your person and make sure that you're centered within your approach, because I'm sure we've all had the experience of being the person at the cocktail party who just talks and talks and talks and talks at someone until they're like, I have to go to the bathroom now. So we have to make sure we're not anxious when we're speaking. So I believe what planetary health brings to the conversation, it's such a unifying lens. It allows us to talk, to call to the best in people and say, hey, what we all want is a healthy now and a healthy future for our kids. And we know from communications evidence done by Ed Maybach and others that calling to a healthy future is really the best way to motivate action on climate change and other issues across the political spectrum. So I just find it's, I believe that humans are good. I believe we create in-groups and out-groups that are unhelpful. So if we can call to that human family impulse and make us all an in-group working towards the same goals and alignment, I believe that, and I've seen that that's what motivates people in a really beautiful way.
Oh, you've earned my vote, and I'm not even Canadian. Clearly, both of you are exciting people, because the last couple of questions are about how can we get involved. Sandeep, I know you do a lot with civil society organizations, and with your work in the regional hubs, you're out there getting people and organizations involved. And that was the question is, what can civil society organizations do to support a planetary health platform?
Build a big vision. Build a big vision. If your vision is very small, and as I say, bring people together, then people wonder about the person sitting next to them. I would not want to work with this person. I do not want to work with that person when your vision is small. If you build a big and broad enough vision, and persons can understand that that vision has a meaningful impact at the end of the day, the person sitting next to them is inconsequential, because they'll all be working towards attaining that vision. So, the reality of dealing with these issues and building these societies and so on is moving beyond the person and beyond the personality to moving to a state where the mission and vision is so broad and encompassing there's space for everyone to do their work and do it in a harmonious and peaceful way. As Courtney said, you know, people are good by nature, and we have to tap into that goodness and ensure at the end of the day we are truthful, respectful, and also transparent to them in ensuring that what we do is worth happening, and then we'll get somewhere. I hope I answered it, Teddie.
It was lovely. Thank you so much. Courtney, how can the planetary health community best achieve political change? From the inside of politics or through political pressure outside systems? Do we need more research? Do we need more education, community building, or is it a particular focus on lobbying?
It's all of the above, but I think what's really important is that we allocate resources to it. So I was so delighted within the education framework that we launched yesterday that movement building is like an integral part of the strand of woven threads. And Teddie, I know you were, you were one of the main editors of that document, and I know you were a big advocate for including that. And that's so important because it's one of those, that quote is, organized social movements to achieve change do not just happen. And that's true, it takes time and effort and work. We spent all day yesterday, for instance, interviewing a new executive director for Kate. And it was great, but that process has been going on for months in the middle of a pandemic. And so if you're not making time in your life for it, if we are not allocating financial resources to that work of change making, who's going to do it? You need a secretariat, you need the people, you need the strategists, you need the communications, you need the visuals, because in this, in this particular time, if you don't have arresting visuals, you just look like, kind of a neophyte compared to the big PR companies that we're up against. And so for a long time, we sort of had it in our peripheral vision and kind of been hoping something will happen there. And I think we're at a moment where we realize that if we want to create change, we need to be strategic about it. So I believe there's a different season in everybody's life for a different kind of work. I've opted back into nonpartisan work because I've got kids at home, and this is a good season for me to do this. So we're back to, through an evidence-based lens, influencing people across political parties. And we had a really good response around our Earth Day call for increased targets from Canada. And so I think that depending on who you are, what your risk threshold are, what you love to do, there will be a different thing for each of us to do. And the important thing is that we're just supporting one another, because doing new things can be scary. And one of the best ways to reduce that courage threshold is solidarity and mentorship and the example of somebody kind of like you who'd sort of done something similar and it went okay. And I think in some ways, being gentle with our own egos, we're going to do things, and you're interviewing somebody who didn't win in politics, and that's okay. Because every single time we try something, there's totally the risk of it not working, but you didn't get your cartwheel the first time you ever tried it either, right? So we need to be as playful, as creative as our kids are when they're trying everything for the first time, as we try all of these new things in the hopes of creating a better world for them.
Absolutely. One of the audience said, are humility and compassion important? And absolutely, you do not get relationships built with arrogance. And so very important that we reach out to the people around us, excite them to be part of the vision of the great transition, make our vision big and room enough for everyone to be included. In the words attributed to Gandhi, we must be the change we wish to see in the world. And that is the challenge for all of us. Thank you, Courtney and Sandeep, for your humility, for your deep knowledge, and for your compassion, and for leading us the way. Thank you so much.
Thank you very much.
Thank you so much. Thank you for your wisdom and your systems thinking and all your leadership, and really to everybody who so heroically put this conference on in the middle of a pandemic in Brazil. I've just been so awed by it, and so thank you. It's just so inspiring.
Teddie, I could just say ditto, and thanks again for everything.
And I'll turn it back over to Marie and Antonio.
Hello. My goodness, that was exciting. I could be listening to you for hours more. So today we'll just take a moment in these closing remarks to again thank all of our speakers and panelists, our interviewers, our moderators. It's really been fantastic on this fourth day of the 2021 annual meeting, where we've had over 4,900 registrants coming in from 129 countries. So we're delighted that that number continues to grow even as the conference is moving on. We continue to have dynamic and rich conversations with thought leaders, entrepreneurs, activists, policymakers, and others, which makes these conversations so relevant and so rich. This week, we've explored foundational values needed for achieving planetary health and the Great Transition, learned about the knowledge, education, and funding structures and systems supporting advancement of planetary health. And yesterday, it was dedicated to highlighting transformative businesses and new economies to achieve planetary health. Today's conversations were about governance and cooperation, and it brought in voices from around the world, from Thailand to Kenya to Brazil and other places, to bring in a wealth of thinking, a wealth of perspectives, and so much sharing. And a lot of today and this week highlighted the need of changing the narrative we tell ourselves and each other, the importance of creating strong collaborations, and moving fast to take action for a healthy and just future. We heard about the role multilateral organizations can play in mainstreaming not only the concepts of planetary health, but also to embed action into policies around the world. We also heard about really exciting real-world, on-the-ground actions that are taking place from communities in Madagascar to the Amazon to legislation and action in Wales. These were terrific examples that not only give us hope that real progress is being made, but they also serve as models that can be used throughout the world to create the change we need. And we just wrapped up with an inspiring interview discussing how to bring a planetary health lens into governance and policies. And overall, it was just a terrific day with a lot of practical suggestions for moving the planetary health dial in a positive direction. Now, I'd love to hand it over to my dear colleague, Antonio.
Thank you, Mary. And it's so difficult to try to summarize it all because there have been so wonderful conversations, so much to think about and to visit again and to watch again. But happily, everything has been recorded. So if you haven't been able to watch them, or if you, just like me, want to go and watch them again, please know that all sessions are being recorded and they'll be posted over the next couple of days. You'll be able to find the main sessions, main program recordings on these events platform and soon on the Planetary Health Alliance YouTube channel. Remember that recordings will be available in English, but also in Portuguese, Spanish, French, and Mandarin. So if you know that someone that will be delighted to watch them in these other languages, please tell them. We also invite you to join our community by becoming an individual member through our newly launched online community called HILO. So you can become a member of the PHA Alliance individually. And HILO is also a great place to keep conversations going on now, this week, and then on also. And becoming a member of other communities like the Planetary Health regional hubs, for instance, and other groups. So visit the Planetary Health booth and HILO and become a member of each of them. Also consider adding your voice to the São Paulo Declaration Global Consultation. This declaration will be the first document of its kind that the Planetary Health community will be launched, outlining the actions that are necessary to achieve the Great Transition. Learn more also on the booth areas, on the exhibit area, not only about the PHA, the São Paulo Declaration, but also from all others sponsors. And please remember that shortly in 10 minutes, we'll have the Science Lightning Talks today on infectious diseases. So get there and see the talks. And also remember that we have a number of side and festival events going on. This afternoon, for me, it's afternoon here in Brazil, this evening and tomorrow morning. So any time in between now and today's new program, there'll be something happening and you can watch it. Thank you for being with us today and keep in touch.
Thank you. Be well.